I want you to keep in mind that menopause is kind of a perfect storm for leakage. It is something that happens as a physiologic change to all women at some point in their life. However, it is not a life sentence. So what are the types of leakage you might notice? I'm just going to go over a couple main types that I deal with frequently in the office, and that is stress incontinence, which is predominantly the leakage with cough, sneeze, physical activity. You may recognize it from when you laugh so hard with your friends that you pee your pants, or if you're exercising at a spin class and stand up on the cycle and you end up having a few drops, or if you're just doing daily activities and when you lift something, you start to leak. So that is called stress incontinence. It's an actual stress on the bladder, a force put on the bladder that overcomes the urethral sphincter complex that holds the urine in, causing leakage to occur. The other type that is the main component that I deal with in the office all the time is called urge incontinence. And that's where you have that sudden urge to go and you can't hold it long enough to get to the bathroom. Some people remember that commercial where they used to say, gotta go right now. Well, that's urge incontinence. It happens very frequently when people do things that are repetitive in nature. For example, putting your key in the door with your groceries and you didn't have to pee at all until you got to the door and then you suddenly have to get to the bathroom. Or when your feet hit the floor in the morning and you have to run to the bathroom. You should have enough time from when your brain detects that you are having an urge to go and getting to the bathroom. And when you don't, it's called urge incontinence. Now, what I commonly see in my office is that most women have a little bit of a combination of both after menopause. Not everybody's 50-50. It can be predominantly stress incontinence or predominantly urge incontinence, and we always try and deal with those bigger issues first. But many women actually have a combination of these two types of incontinence.